So let's talk about another key component of advanced primary care, and that is the concept of developing a high value visit model within your clinic. So, what is a high value visit? Really, this visit is designed for complex patients with high acuity needs primarily, but can be used for any patient within the practice for which you need to establish care and develop a trusting bond between the clinician, the care team, and the patient. So the high value visit really is designed to build trust and connection, and this is really the primary goal of this visit. The secondary goals are to do things like close care gaps, capture accurate diagnoses for risk assessment, and manage high risk conditions proactively. Ideally, this is used for our more complex patients, but certainly could be applied to patients that are seeking care to establish a long term relationship with you and your clinical team. We also want to use these visits for hospital follow-ups because hospital follow-up patients obviously are high risk because they've been hospitalized and will need more proactive planning done for their care plans. So who should be prioritized for high value visits? The way to do this first is to risk stratify your population. Select the highest risk groups in need of follow-up or annual updates for their care plans for high value visits. The rising risk group are people who are in the right lower quadrant, which are low cost but high risk patients, also need to be prioritized for high value visits to preemptively intercept any ongoing medical conditions they have that could progress to be high cost and high complexity problems for that patient. So having proactive outreach is really important for the primary care clinic to actually establish care with these patients. Finally, you also want to use pre-visit preparation for patients who are coming in for high-value visits to be sure you know what care gaps need to be closed, what diagnoses need to be captured and addressed, and to develop these active care plans for these patients.